name is Lauren Bailey. This is not the first time that I've had to go after the sex talk. Okay, so what's our bottom line up front? So we have 22 million veterans out there in the United States. We reach not even half of them at VA. And so what we need to do is get the right information at the right veteran, to the right veteran at the right time. In 2009, you had one guy in a cube with one computer who ate foot-long subs for lunch every day, no staff and no budget. And now we have every single VA medical center, and just so you know, VA runs the largest integrated health network in the country on Facebook. We have 75 Twitter feeds. We have a YouTube channel, 2 blogs, a Flickr page, and a partridge in a pear tree. So basically what we were trying to do was really start reaching the veterans where they are. And that's why the success has been so rapid and so easy almost with Facebook for our medical centers. Veterans don't think of VA as the big building right across the street from the White House where I work. They think of VA as their hospital down the street, as their regional office where they're interfacing with our field people every day. And so we wanted them to be able to get the information that they wanted on the level that they wanted. And we found that Facebook has been the best way to do that. But we're also moving into Twitter, and everyone really likes Flickr too. So we're really experimenting on how we can get veterans their information in ways that they want at the level that they want. And one of the things we notice is the more that we talk to them, the more that they come back. And that's been a real key thing at VA. I don't know if any of you have worked with us before, but we're not really known as the most open and transparent place, right? And so having a forward-leaning leadership who said, you know what, it's okay if you go out there and talk to veterans on Facebook. It's okay that they're able to give you feedback. We want to hear what we suck at. We need to understand what we can do to make your care better immediately. And that's had a really big impact. We've really started to create a community of trust, sort of as Larry mentioned, and we have an outcome that's been very, very positive. So these are the platforms that we use. First is VantagePoint. This is staffed by my staff that I oversee every day. They're veterans, they're writers, they talk about everything from the GI Bill to how they feel every Memorial Day. And what's different about our blog, as you can see on the right-hand side, we allow people from anywhere. If you're a veteran on the GI Bill, if you're another bureaucrat at a federal agency, if you have something to say about Veterans Affairs, we'll take your piece and we'll put it up on VantagePoint and we'll push it out. As long as it's providing some good information to veterans, we're about it. Facebook, as I mentioned, is really where the crux of our communication strategy lies. That has been the best place for veterans because before VA was online, that's where they were going. They're meeting up with their old Army buddies. They're talking to the guys that they were at sea with. And they were doing it without us. So we just met them where we were. And that sort of is really been the cornerstone of our communication strategy online. Everyone's sort of coming at us, you know, why aren't you on Google+? Where's your Pinterest account? I want to see VA on Instagram. Well, until the veterans are clamoring for it in the way that they were clamoring for Facebook and especially for Twitter, we're not going to go there. So it's been really important to go where the veterans already are. I mentioned we're on Twitter. Twitter for us is less of a feedback mechanism in the way that Facebook is. All of our comments are open on the blog and on Facebook, and so veterans just pour there to interact with us and talk to our veterans who work on our social media team. Twitter not as much because they haven't come there as frequently and as often because they don't think they feel they're getting the same feedback mechanism, but this is the way where we interact with people like you, our partners in the federal space, our partners in the private sector to get good information about these cool projects and programs that you guys are working on. And then Flickr. Flickr has been wildly popular. We've been able to really leverage the fact that veterans want to share their experiences and their stories through photos. So what we actually, one of our biggest, most successful projects was this past Veterans Day. We solicited pictures from all of our veteran employees. We have 300,000 VA employees, and we have about 30,000 veterans who work for us. We asked them to send them our pictures and of them in uniform, and we posted them on our Flickr site. We had about 1,500 photos of VA employees, and the veterans just loved it. They went crazy looking for the people that they work with all the time, trying to see those old photos of them in uniform. And so we've been trying to replicate that, especially with our leadership who does a lot of traveling and a lot of outreach with veterans, showing them that we're out there and we're working with them. And then we're on YouTube. YouTube is really, it's fun for us because we have a lot of internal video communications that a lot of veterans just don't see. It airs on the Pentagon channel, sometimes it'll air at the medical center, and people don't have the wherewithal, they're trying to get to their appointments or whatever. And so they can come and they can see the hard work that our internal communications and our media products people do to get information about VA employees, the cool things that we're doing at some of our different sites, up and on video. As I mentioned, this has been a really popular tool for us because I think that veterans like seeing what we're doing and seeing how we're interacting. Okay, so how do we do this? So as I mentioned, it's all about localization, but for us at the VA level, it's all about this sort of centralization. When I started at VA shortly after my boss, who was the one guy in the cube with the foot-long sandwich, started, it was like the Wild West on the web. And actually, our Veterans Health Administration took over the social media sort of for the department, and they sort of led the charge because they knew, they were so forward-leaning that they knew that this is where we needed to go for veterans. So when my boss came on, he recognized the need not to control it, and that's not how we govern. What we do is we try to make sure that the resources are available for people and that the process is streamlined and easy. So we don't want our social media managers to have to think too much. We want them communicating with veterans. We don't want them worrying about policies and stuff like that. And then standardization. All of our stuff on Facebook looks the same. So I just wanted to, this is a great chart for localization. So if you see, this is VA growth over the last 3 years. And as you can see, VHA is not far behind it. And that's because we have, as I mentioned, an amazing team at VHA who's really trying to get the information to the veterans at the local level. So this line right here is our VA medical centers. So while they don't have as many friends as we do, they're tracking in the same way that we are. And this really impressive growth is something that it's been very impactful with our leadership, and they can get really excited about it. So I'm really happy about everything that VHA has done to do that. So, okay, where are we going? So what we're not the best at right now is measuring our reach and our impact. There's only 5 of us on the ground at central office. Every medical center probably only has 1 to 1.5 people trying to do social media, and that's a lot compared to VBA and some of our other staff offices. So we don't focus too much on how we're impacting other than the information that we get back from veterans just in talking to them online and sort of the feedback loop that we have. So we're going to try to do better with measurement and our reach and impact. It's really hard to get some of the comments and questions that we get to the right people quickly. So we are sort of trying to get all of the information out and back to the veteran as quickly as possible. We don't have a formalized feedback loop for the, trust me, expansive bureaucracy that we have at VA. And I don't mean that pejoratively. There are lots of people doing lots of good work, and we just don't have the time or the face time to sort of work with them all the time. And so what we need to get better at is providing them the questions that we get and sending them out so that the veterans have the best information from the right people. Governance. This is what keeps me up at night. And again, it's not about telling people no and telling people what they can't do, but for us it's about really streamlining the process and sharing resources. So, and this is really critical as we sort of launch into mobile. We're literally hurtling down the field with some of our mobile apps, and we're afraid it's going to be Wild West territory again. And then really getting our leadership involved. They've got a lot on their plate, but really making them accessible to veterans online in a very impactful way is what's next for us. Great.
Thank you, Anna. Okay.